So one of the most common problems that patients come to me for are their breasts. How do I rejuvenate my breasts? What's the right way to do it? What's the best procedure for me? So the most common complaints: small breasts, they don't fit my body; deflated breasts, I've breastfed, I've had several children, I've just lost the volume and shape of my breast. And then just sagging breasts. The breasts have just kind of succumbed to gravity, and that's typically what we see with aging. So what are my options? One, if you have just deflation, need more proportion to body, you can do a breast augmentation. And we typically use a silicone gel-filled implant. They come in different styles because we're really trying to customize the implant to you. It's not a one-size-fits-all type deal. Implants come in various styles, and that's really based on their footprint and their projection. They could be a moderate profile plus, or high profile typically. And so where do we put the implant? We want the implant to look most natural. So I typically put the implant through the natural fold in your body and create a pocket underneath the muscle, as well as partially underneath the breast tissue itself. That's called a dual plane. And that gives nice, soft coverage to the implant and makes it look and move more natural. We also take advantage of computer imaging to help us visualize what a particular implant style or size would look like in you specifically. And we also use sizers to help you get into that size range. So that's where we're trying to customize and individualize the augmentation for you. Now, what if you need a lift? What if you have plenty of volume, but it's just not in the right place? Well, it just depends on how much we have to lift. We can use incisions just around the areola. We can use the areola and a single incision that runs down the breast and out laterally along the fold. Or sometime, if we really have to move things around, we might use the upside down T incision. We also want to support the incisions as well, so we use a special wound support system called bridgets. And they stay on up to 6 weeks to help support the wound while it's healing. Now, some patients may need a reduction on one side, and we incorporate that in with the lift. Sometimes part of the lift is actually reducing the breast. So when you do a reduction, you actually get a lift along with it. Now, what if I have a combination? I need volume, I have some droopiness to the breast. Sometimes we do a combination of breast augmentation and a lift. Sometimes if you're on the fence, we might do a lift first because that's what you really need. That's the primary problem. And then decide if we want to do a implant down the road, say 6 to 8 months down the road. Or sometimes we do it at the same time. That carries a little bit more risk because we're doing two different things to the breast at the same time, but typically it works out very well and give a nice correction and lift of the breast, but also add volume and shape as well.